Welcome to Week 6, Part 1 of the DPS NCLEX Success Track. In this lesson, we focus on early deterioration, the critical window before a patient collapses. This concept is extremely high yield for NCLEX and next generation NCLEX because the exam tests whether you can recognize danger before it becomes obvious. The purpose of this section is simple but critical: to help you identify early deterioration before collapse. Many NCLEX failures happen because students wait for late signs like hypotension or cyanosis. NCLEX wants to know if you can catch the problem early. These 4 rules guide almost every NGN question in this section. First, trends matter more than single values. Second, subtle signs are more important than obvious ones. Third, early findings are more critical than late findings. And finally, unstable patients always come before stable ones. Deterioration means a gradual worsening of the patient's condition. It is not sudden collapse. It is the quiet, progressive change that happens before things become emergent. NCLEX expects nurses to notice this progression. This slide is extremely important. A slow drop in blood pressure, a gradually increasing heart rate, decreasing urine output, or rising oxygen needs. Each one alone may seem minor, but together they signal danger. NCLEX loves trend-based questions. Neurological changes are often the earliest indicators of deterioration. New confusion, restlessness, agitation, or unexplained anxiety should never be ignored. On NCLEX, mental status changes almost always signal worsening perfusion or oxygenation. Respiratory deterioration often begins subtly. An increasing respiratory rate or use of accessory muscles may appear before oxygen saturation drops. Remember this key rule: restlessness is an early sign of hypoxia. From a circulatory perspective, watch for tachycardia, narrowing pulse pressure, cool clammy skin, and delayed capillary refill. These findings indicate compensatory mechanisms are failing. This is classic NCLEX material. This slide represents one of NCLEX's favorite concepts: pre-shock. In early shock, blood pressure may still be normal. Instead, you see tachycardia, mental status changes, warm skin in early sepsis, and elevated lactate. Hypotension comes later. One of the most important nursing principles tested on the NCLEX is this: nurses recognize deterioration before providers diagnose it. You are not waiting for a diagnosis, you are identifying risk and escalating care. In NGN, the first step is recognition. You must identify abnormal trends, recognize red flags, and determine that the patient is worsening. If you miss this step, every other decision will be wrong. Once you recognize deterioration, you analyze which system is failing first. You then apply the ABC framework and decide who needs care first. This is where prioritization questions come from. Next, you act. This means escalating care early, notifying the provider or rapid response team, and implementing safety interventions. NCLEX rewards early escalation, not delayed documentation. A postoperative patient's vital signs over the last 4 hours are as follows: BP 11872-10468. HR 88112. Urine output 45 ml/HR 20 ml/HR. SPO 95% on room air unchanged. Which finding is most concerning? A. Blood pressure of 10468. B. Heart rate of 112. C. Decreased urine output. D. Oxygen saturation of 95%. In this question, we see multiple vital sign changes over time. The most concerning finding is decreased urine output because it reflects poor perfusion, not just a number. NCLEX almost always prioritizes perfusion indicators. Correct answer C. Decreased urine output. Question: which assessment finding is an early indicator of clinical deterioration? A. Cyanosis. B. Bradycardia. C. Restlessness. D. Hypotension. Cyanosis and hypotension are late signs. Restlessness is an early sign. On the NCLEX, early signs always win. Correct answer C. Restlessness. Which patient is most likely in the pre-shock phase? A. BP 8240, hour 132, cold clammy skin. B. BP 11,876, hour 120, warm skin, confused. C. BP 9060, hour 58, cyanosis present. D. BP 13,080, hour 72, alert and oriented. The patient with normal blood pressure but tachycardia, warm skin, and confusion is most concerning. This patient is in pre-shock, and intervention must occur now. Correct answer B. Question. A nurse notices that a patient with pneumonia becomes increasingly confused and restless. The provider has not yet evaluated the patient. What is the nurse's best action? A. Document findings and reassess in 1 hour. B. Administer prescribed antibiotics. C. Notify the provider of possible deterioration. D. Wait for lab results to confirm infection. The correct action is to notify the provider of possible deterioration. Waiting, documenting, or delaying for labs is unsafe. The NCLEX expects proactive nursing judgment. Correct answer C. Which patient should the nurse assess first? A. Stable heart failure patient with mild edema. B. Post-op patient requesting pain medication. C. Patient with increasing oxygen needs and restlessness. D. Diabetic patient with glucose 220 mg/dl. The patient with increasing oxygen needs and restlessness is unstable. Unstable always comes before stable. This rule alone can answer many NCLEX questions. Correct answer C. Remember these 3 principles. Deterioration happens before collapse. Early action saves lives, and you must always reassess after intervention. These rules apply to almost every NGN case.